Hello to everyone, let me introduce myself. I'm Molina from Dianova. It's a pleasure and an honor to have the opportunity to present what we are doing last moments about drug treatments. What we consider that are new challenges for social intervention and drug treatments in all in evolution. As you know, Dianova is a network. It's an international NGO which comprises organizations and foundations operating in 4 continents: in America, Europe, Asia and Africa. The Dianova members organization contributes for the development of individuals, of communities and organizations through a variety of programs and interventions in social, health and humanitarian sectors. Our main activity is in drug treatment and services. Our key principles is that we have to develop initiatives and programs with the objective of promoting personal self-reliance and personal progress. Because our vision of this kind of services is that with appropriate support, each person will be able to find within him or herself their own needs and their own solutions and the initiatives to solve their own problems. And our responsibility of service producers is to offer the possibilities to improve the quality of life of people. That's why, for example, when we're talking about drug treatments, we can offer recovery-oriented programs and evidence-based practice as harm reduction programs. We consider that what we want to do is to increase the quality of life of the people. And what we want to do, and what we have to do, is to offer the most adequate service in any case to any person. Our activities are in different topics, in different sectors. Fundamentally, as I said before, in health services, normally in drug treatments, education and training, and humanitarian, social and community services. We have different kind of residential treatment, of treatments for people that has got drug problems. We have residential treatments, therapeutic communities, and other kind of residential facilities and outpatient centers. We offer different kind of residential and outpatient services for adults, for minors, for people with special needs, as women with children, for dual pathology patients. We are orienting our services and programs to identify the needs of the specific core groups, because what we want to do is to increase the quality of our intervention in addictive behaviors. So that's why we are trying to integrate recovery-oriented programs and evidence-based practices with a perspective of biopsychosocial intervention. Of course, trying to combine the treatment of pharmacotherapy and psychotherapy to offering the treatment that all the people need. We want to make different kind of intervention, and we are trying to identify, and we are making an effort for identifying different kind of intervention for specific populations. We have identified and we are developing now different kind of intervention specific for 4 groups: for dual pathology patients, for women and women with children, for behavioral addictions and behavioral disorders, and for people that has failed previously in other kind of treatments that need specific services, that need other kind of services. And we are trying to provide scientific evidence of our intervention, making evaluation of our programs and need assessment of our core groups. We are making now an effort identifying the different stakeholders that can provide us information to increase the quality of our services and to put the focus of our services in the specific needs of different core groups. As stakeholders, we are talking about as political partners, public organizations, private partners, other NGOs that can give us information to develop and to detect new needs and new possibilities of intervention. And of course, we include the opinion and the information from our main stakeholders, that are the drug users, the specific drug users, trying to identify the different patterns of profiles and patterns of drug use, different categories of psychosocial intervention and needs, the different specific characteristics of the people that we have to work with. So what we are doing now is an effort to adapt our treatments from recovery-oriented services to evidence-based practice. We are respecting and we continue working in therapeutic communities. We are offering other kind of services to the people that can need. So that's the effort that we are doing. If you want to know more about the process and the results that we are having now, don't hesitate to contact us. So a lot of thanks for giving us the opportunity to explain our work. Thank you very much, and we hope to see you soon.